Sit beneath the fiddle tree with the ghost of Neil Gown next to me. Listen, Neil, your apprentice has begun. And the old man sits in the ingle nook and wonders. His brother in a foreign land, he must remain. And he deemed about the life he'd choose, each would wear the other man's shoes. This motherland is a constant source of pain. Oh, no more Aberrove, no more it's over. Oh, no more Aberrove, no more it's done. Now we'll sit beneath the fiddle tree with the ghost of Neil Gown next to me.
For inviting me. Obviously, this is what I spent an awful lot of time last year doing. After one of my speeches was videoed and went on YouTube, my husband, who's skulking at the back, and I ended up travelling 5,000 miles, literally from Arran in the west to Cooper in the east, from Langham in the south up to Elgin in the north, and kind of all parts in between. And we met some amazing people, and we had some fantastic discussions. Now, obviously, the outcome isn't what a lot of us would have wanted, and I'm sure many of you were like me, lying on the sofa with big puffy red eyes for at least half of the 19th. But a lot of the unionists felt that we should just disappear, that we should change our names, you know, women for Devomax for women. I mean, it just doesn't have the same ring to it. And they don't seem to understand that if you believe in something, you don't just give up at the first attempt. You don't go away. Labour didn't give up when they lost the general election in 2010 and the Scottish election in 2011. I mean, they are making a pretty good job of disbanding themselves at the moment, but they're still there. And it took us a wee while to get through that. I mean, an awful lot of our groups, you know, what will we call ourselves? Will we change our names? And especially now that Jim Murphy has decided to try and steal the word yes. I'm sorry, that is game over. We're not having any more name changing. We're back to yes, whatever, because he can't have it. It's ours. Now, despite some of the attacks you will have heard on me during the referendum, I didn't start talking about the NHS or studying the NHS because of the referendum. I'd been following in the media what was happening to the NHS in England since 2011, when they first started talking about what they were thinking of doing. And along with many other doctors south of the border and the BMA, I just couldn't believe what they said they were thinking of doing. Because it was clear it would cost a lot more money. It was clear it would break up the NHS and get rid of collaboration and cooperation, which has always been its strength. And I thought, no, somebody doesn't understand something. But that's exactly what they were doing. And I get media links from my college every day of media stories about health all over the UK. And what was clear was that in big UK papers, you were getting talk about this, but not in the Scottish edition. I mean, it was like there was a media blackout. And I felt before people made that decision in the 18th, they needed to know what was happening south of the border. And that was why I spoke out. And it's still going on. The NHS is still being dismembered south of the border. It's still being broken up. And in the last 18 months, the decisions about what treatment will be provided in an area are made by groups of GPs. And that means that different areas choose to provide different things. We have spent decades in the NHS, as any other medics here can attest, trying to fight against what was called postcode prescribing or postcode access. That's actually their deliberate policy, is that different areas will simply choose, we provide that treatment, we don't provide that treatment. We provide it here, we don't provide it there. And all the services that are coming up for renewal, the contracts must be put out to tender between the NHS and private companies like Virgin, Atos, Circle, G4S, whole big list of them. Now, the problem with that is it costs a lot of money. You've got bid teams, you've got corporate lawyers, competition lawyers, and you're spending money on that whole process that isn't doing anyone any good at all before you actually get down to providing doctors and nurses and drugs. So it's taking money away from patient care. And health economists like Alison Pollock, they estimate that if we keep going on this trajectory towards an insurance-based system, which is what the Oliver Letwin and John Redwood plan was, then eventually you could be spending 30% of what you spend on health costs will actually just be going in organisation and administration. That's like 3 times what we spend now. And that reduces what you can do. The contracts that have been awarded since the change in April 2013, more than half of them have gone to private companies. Now, it's still quite a small proportion, but if every new contract comes up, it must be put out to tender. And there was even one for radiology services that seems to have gone to the private bidder, even though what they are proposing will actually cost more than the local NHS bidder. So it's hard to understand the rationale of some of these decisions, other than what Westminster believes, the relentless move of public services to private hands. We had it with energy companies, with British Rail, with the Post. Everything is we should not own things. Private companies should be owning things. And it's a one-way street, because when they take over a service, the NHS version of that service ceases to exist. Because either they move that business to a small private hospital if they've got one, and the NHS can't afford to keep us standing around twiddling our thumbs for 5 years, so our staff get made redundant. Or what happens more often, they don't have a wee private hospital in their back pocket. They take over pieces of the NHS. They take over buildings, they take over staff, they take over machines. Things we bought, people we trained, places we built with our taxpayers' money are handed over to a private company to make profit out of. Now, in 5 years' time, when they put that franchise up to be bid for again, another company might sweep in and take it. But there's no NHS version of that service left to bid. So this will be a relentless move, bit by bit by bit, into moving these services into private hands. And it means that different groups of doctors are competing with each other. They're not cooperating, they're not collaborating. And it is all much less efficient, it's all much more expensive. And at the end of the first year, 40% of trusts in England were in debt. So what's happening now? They're now starting to ration treatment. There are commissioning groups who, if you have a cataract, they're only going to get one eye fixed. Now that's okay, because you can basically see, but if you'd like to put your hand over your eye, you realise you've absolutely no sense of depth at all. So if you're 70 and you're stoating round your house with your one-eyed vision, your chances of tripping over a carpet or banging into a piece of furniture, falling, breaking your hip, not getting the stairs right, they go up. It isn't cost effective to do that. There's a group down in the southwest who've decided that if you're hard of hearing, you should only have one hearing aid. Because, oh well, now you can hear. Well, unfortunately, the car may hit you from the side you haven't got a hearing aid in. It just does not make sense. It's absolutely against the basic principle of the NHS. A couple of the think tanks in England have suggested that they might bring in charges, actual overt charges, to go and see your GP or to go to A&E. So this is the King's Fund or Reform UK, and they've suggested prices ranging between £5 or £10 and £25 to go and see a doctor. And I've heard people on radio phone in saying, oh, well, you know, I would pay that to save the NHS. I'm sorry. If you're paying to go and see your doctor, you haven't saved the NHS. The NHS is dead. The 66-year experiment of free healthcare at the point of need would be over. And we would all be the losers for that. I retweeted a thing that I saw a young lad in America, 20-year-old, put up the bill for his appendix. Not a big fancy operation, an appendix. The cost in the bill was $55,000. He was lucky, he was still on his father's insurance. That reduced it to $11,000. That's $11,000 when you have insurance. We take it too much for granted. We don't realise what it's like in the rest of the world. The NHS is one of the greatest things that Britain ever achieved. And they achieved it when they were reeling out of the Second World War. That and the welfare state. And both of them are currently being dismembered. Now, the government say things like, oh, well, you know, it's too expensive, it's not sustainable, it's too inefficient, we need to reform it. They've reformed it in every single government since I became a doctor in 1982. Every single one. And we used to think, why do they keep totally reorganising us? But if you read the Letwin Redwood Plan, you will realise this is a stepwise journey to a private insurance-based system. That's what Mrs. Thatcher called for in the late 80s. And the NHS at that time just simply couldn't have done it. We wouldn't have had the structure to do it. But when you look at a paper from the Adam Smith Institute called The Health of Nations, he broke it down into little bite-sized chunks, just the way you eat an elephant, one bit at a time. So it starts, outsource the cleaners, no one will even notice. Outsource the labs, no one will care. Outsource security, it'll seem perfectly reasonable. Get rid of health boards, break it up into little pieces that can be taken over easily. And when you read that, it's like a horror story. And you realise that we are at step 4 of 5 steps working towards an insurance-based system. Now, when they say that it's too expensive and too inefficient, I would refer you to a report written by the Commonwealth Fund. Now, this has nothing to do with our Commonwealth. It's a Washington-based think tank, and they do a report every 4 years or so comparing the American system with other developed health services. So what they're doing is not to look at ours, they're doing it to criticise America. But what you will see in that is that out of 11 parameters measured, the traditional British NHS came top in 8 out of 11. That was quality, safety, patient access. All of these things, efficiency, we came top in 8 out of 11. We were actually 3rd in waiting times. People think that you wait an eternity for our NHS, but we were actually the 3rd best of all the developed health services. Well, you must think we must be inordinately expensive. Well, no, we weren't. We were the 2nd cheapest in the world. Now, all of this is before the Health and Social Care Act came into force. This is the figures from 2011 to 2013. So if actually we're the 2nd cheapest in the world, and the only one cheaper is New Zealand, where you do have to pay charges, and we're actually number 1 for quality, why are they doing this? Well, it's quite simple. It's just ideological. They do not believe that things should be provided to citizens for nothing. As I mentioned, the welfare state and the NHS. The other one to me is free education. That's why I got to be a doctor, and I wouldn't have been a doctor otherwise. South of the border, these things are gone. Their children are paying $9,000 a year to go to university. They pay for prescriptions. The welfare state, as all of us know, is being taken apart, as is their health service. So it's just a war of attrition on what we've had the luxury of since the Second World War. Now, people wonder, why have they not asked to be exempted from TTIP, the free trade agreement between Europe and America, which could allow big private health insurance companies to muscle in on NHS England, because it would allow them into anything that is run as a market. Well, it's simply because they want them there. Those companies do that in their sleep. They can accelerate through step 5. They're inviting them in. That's why they won't exempt it. And the problem for us is our little border north of Carlisle may not protect us, because they will just challenge that as a trade barrier. We are not a separate country. We stupidly voted to just be a region. And that is our threat. And there's a whole lot of these secret free trade agreements that have actually been being negotiated for several years, and none of us have heard anything about them. There's another one called TISA, which is Trade in Service Agreement. And that's deliberately aimed at opening up the valuable oyster of public services. So this is a relentless drive And our government in Westminster are not trying to fight it. They're actually welcoming it with open arms. Now, obviously up here we've got Jim Murphy, but south of the border we've Ed Miliband claiming he's going to ride over the hill in a white horse and save us. What people seem to forget is Labour laid the foundation. Labour were the ones who changed the NHS rules to any qualified provider. That meant any company registered with the proper setup could provide NHS care. They were also the ones who set up what they called independent treatment centres, which were little private hospitals that creamed off a lot of the easy work, like hernias or knee replacements. So the idea that they are the great protectors of the NHS is just false. One of their members brought in the Clive Efford Bill. But if you read the small print of that, you realise it looks a bit cosmetically like it's trying to reverse things, but it still doesn't bring the responsibility back to the Secretary of State. It actually talks about more commissioning, not less commissioning. So it's very much a sleight of hand to make us think that Labour are going to come in and change this. We need to change this. Nicola Sturgeon has said that a strong group of SNP MPs will vote in Westminster for the NHS Re-establishment Bill. You can look that up online. There's a website. It's Alison Pollock's group that are putting that forward to actually reverse what they are doing. And that, unfortunately, at the moment, is the safest way of us protecting our NHS. Now, I wouldn't like you to think that NHS in Scotland doesn't have its problems. Of course it does. Though often they're not as bad as you might get the impression from your paper. Because when you open your newspaper, they never discriminate whether they're talking about NHS England or NHS Scotland, particularly not if it's a UK-wide paper. And usually they're actually talking about NHS England. Now you can tell because the logos are different. There's our big, strong, square NHS letters. Ours have got the wee hands logo holding you up. But they're two different organisations, and they always have been. NHS Scotland was a separate organisation since 1948. So when they're attacking us, try and make sure that you know which end of the country they're talking about. But of course we have our challenges. Of course we're overrun. Of course demand is increased. But I get sick and tired of people talking about the catastrophe of people living longer. Now, as I get nearer that point, I don't see that as a catastrophe. And I definitely remember getting the distinct impression at medical school that that was the whole point. I've spent 33 years trying to get people to live longer, so it's a bit late to tell me I was wrong all of that time. That isn't our catastrophe. We have two catastrophes. One is we don't live healthy. We have people who have very long lives of illness before they reach the end of their lives. And we're losing our young people. That's why our demographic is getting older. I'm sure there are people in this room whose sons or daughters are down south or overseas or somewhere else because there isn't work here, there isn't a life here, there isn't a career here. We're like a big version of the islands. You know, our young people just hemorrhage away because we're not able to have that dynamism here. And that's what we need to change. You can't fight our poor health unless you can fight poverty, unless you can fight deprivation. You can't keep hold of our young people unless we have a dynamic economy, unless we are going back to using our inventiveness to innovate, to manufacture, to reindustrialize. Those are the things we need to do so that our young people can stay here. Now, if our people had voted yes and we were a country, that would have brought a huge number of jobs up from London and the southeast that we pay for, civil service jobs that serve us. But the job, the house, the spending in the shop, the car, the money spent on sweeties is all down there instead of up here. Now, sadly, we didn't do that. But I do believe we'll get our chance at some time, in maybe the not too distant future. But that's how we tackle our ill health. They talk as if poor people should just be banished somehow driven off, exiled. We'll just drive them out by starving them. But that doesn't happen. We all pay for the misery of failed lives. And we pay for it in prisons, in police, in addiction services, in benefits. Wouldn't it be better if we actually spent money investing in our children when they're young, and even our children who don't be lucky enough to live in a middle-class area with great parents doing a lot for them? Wouldn't it be better if we could be compensating for that to give them a good start? Because at the moment, we are generating the ill health of the future. We deal with the ill health that came from the 80s, the mass unemployment, the despair of men who'd worked all their lives suddenly being on the scrap heap. But we're picking that up now. What are we going to be picking up from the food bank generation? What chance does an 8-year-old have who's sitting in a cold flat in the winter, eating cold food with a non-cook pack from the food bank? There's no possibility of that child learning to read or write or do her homework or learn her 10 times tables, let alone her 12 times tables. We are not investing in our own future, and that's what we need to change. And there's 2 ways that we need to tackle all of this. One is we need to tackle it from the top, and that is that we need to send a strong team south to Westminster, and obviously I'm hoping to be part of that, to try and get all the powers we possibly can so that we have the weapons to change things. What's on the table at the moment is totally disconnected bits and pieces that will not allow us to tackle our problems. But we also need to work from the bottom up. Groups like Women for Independence, Commonweal, Bare Facts, they can educate you. They can invite you in so that you understand more. But you need to be changing your own communities. Just imagine we'd voted yes. At this moment, we wouldn't be independent. They'd be arguing about who was going to sit round the table, who was going to negotiate what. We spent 2 years imagining a better Scotland. We would at this point be planning, what do we need to change? What do we need to do? We would be having to dig the foundations, pour the concrete, lay the first 6 courses of bricks. Well, we can still do that. And the more we do that, the more people around us will be able to see that we can't finish the job of building it. We can't put the window in because we don't have the power. We can't get the door on because we don't own it. And it will make it clearer and clearer to those who were intimidated into voting no, that our future eventually will be that we will be an independent country. So I would like you to look around at your local community and gather together in groups and think, what do we need to do? Do we need to do up a play park? Do we need a better cycle path? Does our primary school need a bit of help with parents getting more involved? Obviously, do we need to help our local food bank? Every community will have different issues. But if people gather together like this, there's an awful lot you could do about them. So we need people to knit the new Scotland from the bottom up. And all of you can be part of that. Because we need to change what we have. We've put up with it for far too long. So I hope to be one of the people going and getting power. I'm hoping you will be among the people doing the knitting or laying the bricks and convincing other people that we can change this. Because somewhere down that path, our journey to a better Scotland will be intersected by more powers. Some of them will be a bit pathetic. Some of them will be better. And we need to use them the best way that we can. But I do believe in the end, we will get what we've spent 2 years talking about. And every single one of us needs to be part of that. Because what we envisaged was a better Scotland for us to live in and a better Scotland to hand on to our children. Thank you.